Why are some people healthy while others fall ill? How is it possible to create such surroundings where each and every one of us would have the same chance for a long and healthy life? These are just a few important questions we are dealing with. Our health is influenced by a spectrum of personal, social, economical and environmental factors, which can have either a positive or a negative impact. These factors are called health determinants. Among health determinants, we include biological and genetic factors, behavioral factors, social interaction, environment and access to health services. This film records work of the Department of Public Health at the Faculty of Health Science and Social Work at the Trnava University within the framework of the European project ACTION-FOH-HEALTH. Trnava is a regional city in western Slovakia. It is the 7th biggest city in the country. It spreads across the Trnava upland and it is 45 kilometers northeast from the capital of Slovakia, Bratislava. Favorable democratic potential, strategic geographic location, preserved traditions and favorable climatic conditions are suppositions of further economical growth. The vision of the Trnava University is to provide quality education, research and help wherever needed. Scientific research and pedagogical workers from the Department of Public Health at the Faculty of Health Science and Social Work educate students in the area of public health, and at the same time they develop such skills among themselves which focus on protection, support and development of public health at a local, regional and national level. The Department of Public Health is a partner of the European project called ACTION-FOH-HEALTH.
The main aim of the Action4Health project is to improve health and quality of life among inhabitants of the EU by fighting against health inequalities through instruments of health promotion. Health inequalities are a part of our daily life and are everywhere around us. What we mean are unfair differences in health conditions. For example, when a poorer man is not able to buy quality, salubrious food. Another example is a situation when a man with lower education does not have enough knowledge about how to prevent illnesses. That makes it possible to identify health inequalities practically everywhere. And this is where the project Action4Health comes in. Each participating country tries to meet the aim of the project by preparing a document, an action plan, which can serve as an instrument of preparing and directing projects of health promotion. Within our action plan, we primarily focus on cardiovascular diseases, as for a long time, these have been the main cause of death in Slovakia, just like in Trnava. The action plan is based on a thorough review of needs, priorities, and situational analysis. Here were the first 2 steps of preparing the action plan taken, when we reviewed available data about the health condition of Slovak citizens and those of the city of Trnava, and we arranged for a meeting of key partners. Based on both what we found out and the concept provided by the coordinators of the project, we subsequently put our action plan together and aimed it at all population groups of Trnava, so that we could meet the idea of fighting against health inequalities. So our action plan also incorporates disadvantaged groups of people, seniors, children, unemployed. Our work did not consist only of an academic projection of the action plan, but implementing some of its parts in practice too. For implementing one of the aims of the action plan, we organised the Faculty Health Days. For the period of a whole week and always in the morning hours, all students and employers at the faculty could have their blood pressure, BMI, percentage of body fat, cholesterol, triacylglycerols, glucose in blood, lung capacity and the level of carbon monoxide in exhaled air measured. According to the results of final checkups, we provided the participants with individual expert advice together with suggestions on how to improve their eating habits and practice physical activities, or eventually highlighted the need of quitting smoking to smokers.
Okrem toho v jeden deň tohto týždňa prebiehali aj prednášky na zdravotné témy, kde sme sa
The checkups were followed by a conference and lectures on health inequalities and health promotion. Then tasting healthy meals and exercising under supervision of professional instructors followed. Apart from the Action for Health team, students of the faculty also helped carry out the checkups.
Okrem týmu Action for Health podielali aj študenti fakulty.
There is an event called Health Days every year at the faculty, and these events are always of high quality. But I have to say that this year the event was of even higher quality. There was a broader spectrum of activities available for participants. I really appreciated this event. I especially liked the possibility of checkups so that I was able to find out something more about my health status. I actively participated at the checkups, as a participant and also as staff. Later I participated at the lectures and I also tasted healthy meals. I helped with measurements and I participated in physical activity and lectures as well as at testing of healthy meals. There are always possibilities to improve the event.
Cardiovascular illnesses are one of the main causes of death, illness and reduced quality of life among seniors. An influenceable risk factor of developing these illnesses is also a way we eat. That is why we decided to organize a picnic of healthy, prepared meals for a population of seniors in the city of Trnava. Their institution for seniors was chosen as a place for the picnic. Apart from healthy meals, we offered the seniors a possibility to have their blood pressure, cholesterol, triglycerols and glucose measured.
In collaboration with a kindergarten, we organised an event for children to promote the need of physical activities. The children, in cooperation with their teachers and our team, travelled to the Silver Lake Ranch by bus, where they first did some warm-up exercises and then went horse riding, running with dogs, playing games for children and many other activities. Physical activity is important in all ages. Therefore, we also arranged an event promoting physical activity among people of working age. Almost 50 participants attended a march to the Temetin Castle ruins. Together with our students, we annually take part in the event Health Days in the city of Trnava, which is organised by the Office of the Healthy City of Trnava. All participants and interested people were offered the chance to have their blood pressure, BMI, percentage of body fat, lung capacity, and level of carbon monoxide in exhaled air measured. Those who came on an empty stomach were also provided with cholesterol, triglycerides, and glucose level in blood checkups. They were given the results of the checkups together with individual expert advice, focusing on changing their eating habits and practicing physical activities, or, in some cases, quitting smoking. Expert advice and particular checkups were carried out by students from the Department of Public Health. I got blood from my finger tested. I was curious whether the results regarding diabetes would be okay. I am really satisfied.
The action plan was created for a variety of people realizing intervention. It is available for anyone who is interested in working on improving community health. It contains main key areas where, according to us, should be a priority for dealing with. It is created in a way to give people realizing intervention a possibility to bring into their own activities and creative ideas only to meet one of the aims of the project. The action plan is completed material created to obtain structural funding for putting it into practice and for securing ongoing activities, which are focused on supporting public health in the city of Trnava. For those who are interested, an electronic version of the action plan can be found on the website of the Faculty of Health Science and Social Work and the Department of Public Health.